The clock is ticking as the deadline approaches to enroll in Covered California if you need health insurance. The open enrollment period was extended from December 15th to help ensure that Californians are able to get the care they need during the pandemic. Now, those who do sign up today will need to pay their first bill so that coverage takes effect at the start of the new year. According to Covered California, roughly 163,000 people in the San Joaquin, Central Valley, and Eastern Kern County areas are eligible for financial assistance through either Covered California or Medi-Cal. And joining us this morning to talk more about the Covered California deadline, why it's important right now, is Covered California's Executive Director, Peter Lee, joining us live. Peter, thank you for being here this morning.
Great to be with you. Good morning.
You know, sometimes people have this idea that when you extend a deadline, it's because not enough people are signing up or you need more time to do that. But in fact, you're telling me it's the exact opposite.
You know, we've got huge demand, but look, we're in the middle of a pandemic. This is like historic. The last thing we want is people going into the new year without health insurance coverage. And so this deadline of today means people can start the new year with coverage. Now, we're going to be open in the month of January. Open enrollment doesn't close till January 31st. But if you wait till January, your coverage won't start till February. And sadly, too many of us know friends, family that have been hit by COVID or other health conditions. We don't want people to go a day without coverage.
And you're saying right now, I think the number you threw out was 1.8 million enrolled so far, and this is the highest you've ever seen?
It is. So this is both. We've had more people going into this coverage year to renew their coverage because we went out in March and said, look, COVID, we're opening our doors wide open. Too many Californians losing their jobs and healthcare coverage. We wanted to get everyone in. So we came into open enrollment with a lot of people renewing, and people are signing up. But again, as you noted, there's almost 160,000 people in the Central Valley eligible for financial help, which means their insurance wouldn't cost them $800. It might cost them $50. People don't know how affordable it can be. And they can find out fast at coveredca.com.
What other misconceptions are out there when it comes to Covered California?
Well, misconception number one is affordability. Look, many of us have insurance through our jobs. We see how expensive it is. We think, I can never afford that. People get very affordable coverage, but they pick the private plan they want. They pick Kaiser if it's in their area. They pick Anthem. They pick Blue Shield. They're in the driver's seat. That's the thing, that people think that it's this government program. We are part of the state, but we are there to negotiate on consumers' behalf and be in their corner and let them be in the driver's seat.
When you're talking about having this coverage, especially during the pandemic and whatnot, someone without a job needs this kind of coverage, then they get into the new year and have the coverage. They can, if they were to be hired and get coverage through a new employer, then Covered California, that would end.
Bam, just goes away. I mean, look, in many ways, many people come to Covered California for like 3 or 4 months in between jobs. Sadly, in this reception, in between jobs might be longer. But the moment you get your job-based coverage, let this one go. And what we're trying to be part of is having all Californians have health insurance. Look, healthcare is too expensive right now. You don't want to be stuck with walking out of a hospital room with COVID with a $60,000 bill. That's what it costs to have an ICU stay today in California. That's a lot of money.
Also, when you're talking about this, now Covered California and Medi-Cal, two completely different things.
Yeah, they are absolutely different things, but we work together. So Medi-Cal is for very low-income Californians, free coverage, good care. If people make no money and have no resources, they can get in Medi-Cal and go to coveredca.com. We'll help you sign up. Covered California, though, private health plans, we give you a subsidy. You use that subsidy to buy the plan that's right for you. Now, 90% of the people that sign up through Covered California get a subsidy. 10% get nothing, but they pick a plan that we've negotiated the best price. With that subsidy, though, they might pay $50, might pay $100, but the subsidy, state and federal, picks up the balance.
You were talking just a moment ago just about the price plan for Covered California, and I'm guessing that it fluctuates depending on what you add to it?
It does. Well, it fluctuates first on your circumstance.
Okay.
You get a bigger subsidy the less money you make. And you go to coveredca.com, you put in your zip code, put in your age, and you put in your income. Those 3 things, you'll be told, okay, you get a subsidy of $500 a month. You pick a plan that might cost $550 or $900. You pick the plan that is a richer plan or a thinner plan. But look, even today, if you're confused, go to our website and click on Find Help Near Me. There's insurance agents throughout the Central Valley that are waiting by their phones. You don't need to leave the house. Now's not the time to leave your house. Call them up. They can help you enroll. And it still can be confusing, but people shouldn't let that stop them from starting the new year with insurance.
Peter Lee, Executive Director of Covered California, we appreciate your insight this morning and spending some time answering these questions with us.
My pleasure. Be well.
Very good.